Welcome everybody to session 7 on Find the Link Parenting. We've had 6 amazing sessions. Thank you everybody for joining early. We'll be starting right away. Apologies for the late start. I'm just going to share my PowerPoint presentation where I'm going to introduce the speakers very briefly before they start speaking. And I'm happy to say that all our speakers are in the house already. Okay, so it's Find the Link Parenting. Our aim is to empower parents and raise change makers. And today's discussion is about parenting and the physical health of children. We have in the house a pediatrician, a surgeon, a pediatric surgeon, and a dentist. And the aims of the series is to enlighten, empower, inspire, and to give. And that's what these amazing people are here to do, to give us some more insight, to give us some more knowledge so that we can be better parents and so that we can empower and encourage others to be as well. Physical health and any health at all is a gift, and it's a great source of distress to a parent when a child is ill. We know how much sunshine and laughter children bring into a home, and we hear parents talk about Oga Madam when a little child has arrived on the scene. So it does cause a lot of distress when a child is ill in a home. And our speakers today, Dr. Busayo Babatunde, Dr. Emeka Nwachukwu, and Dr. Akinlabi Ajao will be doing justice to this topic today. And I will introduce them once I've pinned them on my screen. Once I've stopped sharing, I'll just talk about the sessions briefly before I take this off our screen. So next sessions coming up are parenting and mental health, parents with special children, parenting with challenges, and some more. And it's going to take us all to the end of July. So sit back and enjoy. There are a few sessions on the YouTube channel. Please watch them. I think we have sessions 1, 2, 3 on there already, and the latter ones will be joining them shortly as well. We have an active online group on WhatsApp. You're welcome to join. Keep in touch. They're going to be replays on YouTube, Twitter, Praising Child, Instagram, Facebook page, Living Your Dreams with the Praising Child, which is my motto. And you can send emails with feedback to timmy.praisingchild@gmail.com. And our motto for the series and the sessions, which we believe is going to be our motto for ourselves and our children, is I and the children God has given me, we are for signs and wonders. Okay, next we are having Dr. Emeka Nwachukwu, who is going to be doing justice to the topic on dental problems in children. Dr. Emeka is our dentist, our honorable restorative dentist. He's going to restore us to where we should be regarding dental issues today. Are you happy for me to share as before?
Yes, you can share.
Okay, would you want to say a few words before we do that?
Oh, well, hello everybody. Thank you very much for having me. It's a pleasure. Yeah, I've known about this group for some time, but this is the first time I'm joining in. Like Tammy has said, I'm going to be talking about oral health practices for children. Now, I'm not sure if you guys can hear me. Can you guys hear me?
Yes, we can hear you. We can hear you. Yes, we can. We can.
Yes, we can hear you.
Okay, thank you. Thank you very much for the feedback. So I'm going to lean more to the practical side of things, and it's going to be fairly brief, unlike Dr. Bruce's own presentation. Then maybe if there are questions, that will help us add more flesh to it. So Timmy, you can start sharing now.
Okay, we'll do right now. Can we see the screen? Oral health practice.
Is booting.
Can you see it now?
Okay, we can see it now.
Okay.
Yeah, we can see it now.
Okay. Over to you.
So the first thing I said was yeah, the importance of oral health cannot be overemphasized. You know, it seems like a small thing, but it can become a big thing, because if you don't have proper oral health, you can't eat well. The children can't eat, you know, because they're in pain. Sometimes you may not realize they're in pain, and that's why they can't eat until, you know, after you get worried because they're not eating, and then you realize that the reason why they're not eating is because whenever they eat, they feel pain from their teeth, you know. So oral health is important for nutrition. It's also important because I put sleeplessness here, because sometimes when children have tooth decay and pain, it's worse at night, and they can't sleep. The parents can't sleep, and everybody is distressed, you know, and they come to the clinic, and everybody's just unhappy, you know. Then, you know, when children have malformed teeth, what we call malocclusion, sometimes they are the butt of jokes at different child play groups, you know, and this sort of affects their self-esteem as they grow up, you know. So for older children who are still having some of their prominent teeth, if they're not properly formed, you know, they get nicknames and all of that, and it just generally affects their self-esteem. Then the other thing is, for children who have habits like thumb sucking, tongue thrusting, lip sucking, sometimes it doesn't allow their teeth to form properly. And this also affects their jaw development, because it is the growth of the teeth that helps the jaws to grow and mature. So whatever affects the growth and eruption of the teeth also affects the growth of the jaws, you know, and generally affects the look of the face. And so basically, the importance of the oral health cannot be overemphasized. Now, for the purpose of this presentation, I vetted the phases of children development and teeth into infancy, childhood, preteens, and teens. And then one of the things I say to people, parents especially, is a major chunk of dental issues are preventable, you know, a major chunk. So we can move to the pillars for oral health of children. Yeah, a major chunk of oral health issues are preventable, apart from congenital issues and things like accidents. The commonest dental issues, tooth decay, you know, and all of that. The commonest dental issues, tooth decay, which we call caries, is preventable. And the pillars for having proper oral health for children, I've put them here. Number one is routine. Just as all of us, we have the habit of brushing our teeth before we go out in the morning. Once children are brought up in a way that this routine is a part of them, and the routine I'm talking about is brushing twice daily. Everybody brushes once, at least. I hope everybody brushes once. But once we can get children to see it as a part of life that you need to brush before you go to bed, it goes a long way to prevent so many of the issues that children come down with their dentition. You know, so one major pillar for oral health for children is having the right routine, forming the habit of brushing twice daily and brushing properly. Now, brushing properly takes us to supervision. A lot of times, because parents are busy, sometimes they outsource brushing of their children's teeth to the nannies. You know, and if the nanny doesn't know what the right thing is, even though the children are brushing 3 times, as long as they're not brushing properly, it's not effective, and they still come down with the problems that they would have had if they were not brushing. So a lot of times you have the parents bring the children to the clinic and they say, oh, but they brush twice, they brush twice, they brush twice, they brush twice every day. And then you ask them, who does the brushing for them? So children need to be supervised even up till they are 9, or 10. At least one of the brushing times, they need to be supervised by one of the parents or by a competent adult who knows what proper brushing is. And so, yes, one pillar is get them to realize that they need to brush twice daily, but at the same time, make sure that those times when they are brushing properly, they are doing the right thing. Because if they're not doing the right thing, then it becomes a waste of time. And then the other part of supervision is diet. Diet is so critical to preventing tooth decay or causing tooth decay. So if you have the children taking a lot of sugary foods, a lot of sticky foods, ice creams, the candies, the chocolates, and all of that, those things are the things that form the substrate. They stick on the teeth and they form the substrate for bacteria in the mouth to ingest them. When the bacteria ingest these sugary foods in the mouth or that are stuck to the teeth, they release acid. It is the acid that dissolves teeth and causes tooth decay. So parents are to encourage their children to minimize ingestion of these things, or if possible, stop them completely. So if the children are going to school in their lunch packs or giving them candies, you give them fruits, and all of that. We also advise to if they must take these candies, they should take them at meal times or not too far from meal times. The reason is because when they eat, they generate a lot of saliva. We have a flushing effect in the mouth and sort of reduces the stickiness of these things on their teeth. What I tell parents, keeping it practical is, encourage your children that if they take these things, they need to brush after taking them, or they need to make sure they brush that night after taking them. If it's difficult to minimize, but they need to cut it down. That's another role that supervision plays. If the parents are not there, the nannies need to know that you cannot just give these children freedom to take all the chocolates they want to take, or all the candies they want to take, or all the sticky biscuits they want to take. They need to know that it's not healthy for them. The third pillar that is also very important is regular dental visits. Regular dental visits, one of the major things that we do for people, children included, when they come for routine dental checkup, is just cleaning, something that we call scaling and polishing. We just clean the teeth. But in the process of cleaning those teeth, we are also looking at the teeth, And so if there are any issues, we're able to catch them on time. And treat them early. When we treat them early, the treatment is less painful, less invasive, and less expensive. If we catch these problems early, they are less painful, less invasive. Some of them we can treat by giving injections. They are less invasive, so we can just treat them once and the child goes home without needing to come back again. And they are also less expensive. But if they don't come for regular dental visits and they come only when they're in pain or only when there are issues, the treatment is painful, is expensive, is invasive, and the parent may need to bring the child a few times, which in our today existence, sometimes it's difficult to take out time from work to bring the child for dental visits. But if they're coming for their regular dental checkup, they can come at the weekends, they can come during the public holidays, or when you're on holidays, when it's convenient for you, not when you're forced to bring the child because he's in pain, he's crying, he's not eating, and all of that. Something else that regular dental visits helps us to achieve is if the child is at risk. For example, if the child's occlusion is not developing properly, we can also find out on time and let you know that, okay, this something needs to be done about his occlusion. Either he needs to wear braces. If the child has a habit that has been on for a long time, like tongue sucking or tongue thrusting, we can work on a program to help the child give up those habits, because those habits have long-term effects on the children's dentition and on their bones. And then sometimes some children are more at risk to tooth decay than others. And so when the children come for regular dental visits, the doctor can notice this and say, okay, for these children, you might want to place them on special fluoride treatments. Fluoride just helps the teeth to be more resistant to decay. Or we can also do something called fissure sealing. Fissure sealing basically is, you know, all the fissures that are on the molars and premolars, we can seal them because those are the most common sites of tooth decay. If we find out that the children are at higher risk of having decays, either because they have deep fissures, or when they come, we see that their oral hygiene is not very good and the mother is complaining that, this child doesn't like brushing, doesn't cooperate, or all of that. We can then go on and do fissure sealing, just things that will help to prevent tooth decay from occurring in the child. So these three pillars are so important, you know, because like I said, most of the dental issues that people come with, most of them are preventable, you know, and if we can work more on preventing them, then all the children we need to do is just come in for regular dental checkup. There's no pain. It's a friendly visit. It's a happy visit. And they associate the dentist with happy experiences. A lot of people associate the dentist with pain now because the first time they went to the dentist, they were in pain. And then we had to give them injection before we either extracted the tooth or whatever. And then they think that dentists always cause pain, only cause pain. That's all we can do. But that's not all we can do. And all these things can start from when the child is young. All right, so the next slide, we look at when the child is an infant, what do we do for the child? Basically, when the child is young and doesn't have any teeth, taking care of them, their oral health is just restricted to cleaning the gums after feeding with a soft, wet cloth as much as possible. And then more importantly, don't allow them to slip off with the feeding bottle in their mouth, you know, because a lot of these formulas contain some form of sugar. And you know that sugar is the enemy when it comes to the teeth, because bacteria work on sugar and cause tooth decay. So as much as possible, when they're done eating, take out the bottle from their mouth. Don't let them slip off with the bottle remaining in their mouth for a long period. Sometimes some children, they eat and then they retain the food, they retain the formula in their mouth for some time, they're walking up and down the formula. We also need to discourage this because this is also like leaving the bottle in the mouth. And then the teeth are baited with sugar, baited with the formula for a long time and putting them at risk for tooth decay. And then we move to when the child starts having teeth. The children start having teeth from 6 months, you know, from 6 months, some of them earlier, some of them later. But it is advised that once children start having teeth, we need to start brushing those teeth. It may not be very practical when it's just one tooth, but the advice is, yes, when they start brushing, get a toothbrush, pediatric toothbrush. I mean, you go to the stores, you see those toothbrushes, and they are age labeled on 1 year, 2 year, 3 year toothbrushes. And then you just use a tiny speck of toothpaste, like a grain of rice, and brush that tooth in the mouth, you know, twice daily, as much as possible, you know, and start training the child not to swallow, but to spit out the toothpaste after brushing, you know, even though for those children, the ones that are for children, it's safe if they ingestible. Want to start from when they start brushing to discourage them. But by the time the children are 3 years old, most of their baby teeth will be in the mouth. And this is the time, you know, when it is so important that you start winning the battle. It's a battle because a lot of children don't want their teeth brushed. So it's a battle, and you have to be really, really strong. You have to show the child that this is one battle that I'll not allow you to win. That's what I tell parents, and over time, if you are determined, if you are insistent, the child will realize that, okay, when it comes to teeth brushing, mommy or daddy does not compromise on the brush, So from the time they're about 3, all their baby teeth are out. You start helping them to brush twice daily, every day. Start taking them for regular dental visits, for checkups, and like I mentioned, for fluoride application and fissure sealants wherever necessary, and start discouraging habits, any habits that they have. Thumb sucking is the most common one. Thumb sucking. Some children do tongue thrusting. Some children do lip sucking. If they have it beyond the age of 4, beyond the age of 4, beyond the age of 5, you see the dentist, we have things that are called habit breakers that we can put in their mouths that will stop them from perpetuating these habits. However, it is important to note that, these children, they must be willing, they must be interested in breaking the habit. And so if they are not really interested, if you put the device in their mouth and, they stop, after a while, after some time, when the device is taken out, they will go right back to the habit that they stopped. But if they're interested, what the devices do in their mouth is a reminder for them to stop. And over time, they stop the habits. If you remove the device, the habit is already broken, and they're no longer practicing those habits. So this is the critical period. If children have problems with their teeth here, it can affect the tooth in the mouth. It can also affect the one that is coming behind. Sometimes parents bring the children and we're forced to extract the baby tooth. Now, if you extract the baby tooth too early, it can delay the eruption of some of the adult teeth, because the baby tooth are supposed to actually guide the adult teeth to come out. I'm still talking about childhood, age 1 to 11. 10.
Yes, I've shifted it back now.
So it can delay. Yeah. So if we remove the adult tooth too early, it can delay. If you remove the baby tooth too early, it can delay the adult tooth from coming out on time. It can also make the adult tooth that is coming out to come out in the wrong position, and this can cause challenges that, to correct them, you need to probably wear braces or something, that could have been avoided if the tooth wasn't taken out early in the first place. Sometimes if the baby tooth is infected as well, sometimes, not very commonly, it can also affect the adult tooth. And so you see the adult tooth come out with some scar, some stain, and it's because of the assault that the baby tooth suffered. So it's not just enough to say, oh, it's a baby tooth, we can take it out, it's a baby tooth. Because a lot of parents ask, is there going to be another tooth? If you take out this one, is another tooth going to come out? But once they say yes, they just relax and say, take it out. They're not really bothered. They become a lot more concerned when you tell them, this is a permanent tooth. If you take out this one, nothing else is coming. But it's important to realize that whatever happens to baby tooth can have an impact on the permanent tooth that is coming behind. All right, Jim, we can go to the next slide. Pre-teens and teens, by now, 12, 13, if you've done good work when the children were younger, now they should have formed the habit of brushing. They should know how to brush properly. They should be used to going to the dentist for their cleanings, and they shouldn't be afraid of coming to the dentist. So this period is just basically encouraging them, emphasizing them, supervising, but not as stringently as they were when they were younger. But this is the period when children typically wear braces. This is the best time, because about this time, from about 11, plus or minus 1 year, plus or minus 18 months, most of the permanent teeth have started coming out or have come out. And if the children have any malocclusion, it can be corrected easily now with braces or with other appliances that don't have to be full braces. It's easiest to do it now as those things are coming out. And that's one of the key things that occurs in this period. One thing to note, I have a slide for common dental issues, but there's something called mixed dentition when you have some baby teeth in the mouth, some adult teeth in the mouth. A lot of times in dentistry, we call it the ugly duckling stage, because usually there are a lot of spaces in the teeth, and it's because those spaces that are inbuilt to accommodate the adult teeth. But the parents feel like, oh, their children's teeth that was so nice when they were young is now looking scattered. It is not the time to intervene. We have to wait until all the adult teeth are out. So another common thing that occurs here is baby teeth are very white. Adult teeth are not as white as baby teeth. And so during this mixed dentition stage, when you have some baby teeth and some adult teeth in the mouth, you can see the baby teeth so much whiter than the adult teeth in the mouth. And parents are complaining that, oh, my son's teeth were very white. Now they're not as white as before. And I tell them, first of all, it's because they are permanent teeth, they're not as white as baby teeth. Secondly, it's a lot more obvious now because these baby teeth are right beside the permanent teeth. And so you feel like, oh, these ones are dirty or not clean. But it's just a natural phenomenon. By the time the baby teeth completely fall off and you see all the adult teeth in the mouth, it's a lot more acceptable, and you may not have this complaint that you have now. So hello?
Yeah. Hello. We can hear you.
Hello. Yeah. Are we still together?
Yes,
right.
we are still together.
We are here.
Okay. So after they are teens, the children are adults, and they're off to enjoy their lives. Important to note, I mentioned that certain drugs are contraindicated during pregnancy and early childhood. The most common culprit here is tetracycline. We have tetracycline stains and all kinds of things that we can cause. So just to mention that, when you're pregnant, like the pediatrician said, don't give children drugs that are not prescribed. Avoid medications to children. When you're pregnant, don't take anything that's not, prescribed by the doctor. And always ask the doctor, is this safe? Is this safe? Is this safe? Yes, you can say, oh, sometimes you didn't know you're pregnant, but if you're expecting, if you're planning, you can ask, is it safe to take this or someone that's pregnant, even though you're not pregnant, just to protect you in those phases when you might be pregnant and you don't know. But tetracycline, yes, is a common culprit, that we need to know. And there's so many other drugs that are contraindicated during pregnancy for a lot of reasons. So like I said here, an important rule of return is always let the doctor know that you're expecting. Then the next slide I have here is just to show us on the slide the common dental issues we have. Number one being dental caries or tooth decay. It is totally preventable if we carry out all the things I mentioned. Ulcerative gingivitis is not very common. It's usually because of malnutrition. It's usually seen among people of low income or in children who don't get proper nutrition. Not just low income, but a lot of children sometimes don't get the right nutrition, and then they have these ulcers on their gums, and then it even worsens their ability to eat, It's also a common thing. It happens in children a bit, but it's not very common. Retained deciduous teeth. Sometimes parents come and say the adult tooth is growing in front and the baby tooth is still, adult tooth is growing behind, baby tooth is still in front, and then the child looks weird. What can we do? What we usually do is to just extract the baby tooth. By that time, it's actually ready to fall off. For some reason, it hasn't fallen off. It's a simple extraction. And if the child is not willing for us to extract it, we can just watch it again for another 6 months to see if it falls off by itself. But if it continues to stay, we then have to extract it for the child. Then the other common complaint that I see is discolored prominences, which I've talked about. It's not like the teeth are discolored, it's just because parents are so used to the very white baby teeth. So when the adult wants to come out, they think that it is discolored. It is not discolored. Something to mention here is toothpaste that we use. We expect them, we advise that people use fluoride-containing toothpastes, because especially for children who are in the formative phases, fluoride, when they take fluoride, it is incorporated into the tooth as they're growing and makes the teeth more resistant to decay. So if you're buying toothpaste, you have to, you have to look at it and ensure that the toothpaste is fluoridated. I'm saying this because we have all kinds of toothpaste that are out there now. We have Thymol, Long Range, and all kinds of toothpaste that are not the regular ones that we are used to. So it's important that if you're buying any of these, whether it's GNLD, Forever Living, whatever toothpaste you're buying, you need to contain fluoride. This is probably for children who are in their teenage. Of course, for the very young children, you need to buy age-specific toothpastes for the children, so that what they're taking is safe for them. I think that's about all I have, unless you have questions. So thank you very much for listening.
Thank you very much, Dr. Nwachukwu. I think you've done a great job. I'm sure people already have questions for you, but because we are going to go right into the next session, we'll take all the questions together, put you all on the hot seat, and you all take your questions one by one. I hope that is okay, unless you have another appointment. Is that okay?
I need to rush off to somewhere.
Okay,
all right. I'm planning to travel. This is my last weekend if I travel. So
awesome, awesome. Okay, all right. So
sorry to break the flow.
No, not at all, not at all. Yeah. Okay, you have two questions on here. One is from Dr. Shondurajai. She says, my 2-year-old has been sucking her fingers since she was born. Please give us examples of the habit breakers. Are they available over the counter, or do dentists have to prescribe? I've already asked her dentist and pediatrician, and they didn't have any suggestions to stop sucking. That's one question. Another one is, what are your suggestions for nighttime bruxism? You might need to explain that one, because I'm sure that is above the heads of some of us.
I can see the questions.
Okay, all right.
I can.
Okay, and then
I can see the questions.
I had a question just for you to explain what is occlusion, because you mentioned it, and some people might not know what occlusion is.
Okay. All right, so I can see the questions here. Okay. I'll just take them as they are arranged. So the first one is about sucking. Now, yes, the habit breakers, they're usually, you can't buy them over the counter, to the best of my knowledge. They're designed for the child. They're custom made for the child. We have something called a goalpost that is cemented onto the child's tooth. So they can't put their fingers into their mouth. We have something called lip bumper. We have a tongue rake for people who are sucking their tongue, they have a tongue break. So there are different types, and they are made to fit the child's mouth. So they're not one size fits all. What you would need to do, since you've already spoken to your dentist and pediatrician, is to see a pediatric dentist, and then they will look at the issue and know whether they're going to prescribe a habit breaker for her. GPs may not find it very convenient prescribing habit breakers, because you have to take a measurement of the mouth of the child and then send it to the lab where they make the habit breaker, and then the child comes back and then you sort of fix it to the child's mouth. But pediatric dentists, because it's what they do regularly, it's a bit more convenient for them.
Okay, I have a comment about that.
I hope that
I have a comment about that. In Nigeria, I think I remember a child's finger or hand being put in plaster of Paris so that the child will not suck. What's your take on that?
Yes, something else that pediatric dentists will do is they can give you local measures because they're dealing with it all the time. Yes, I've seen that, the child's finger is bound with something that is too large for them to suck, or is not pleasant for them to suck. I didn't want to mention it because it's local, but the way it is in Nigeria, those who have been dealing with it have local measures that they can advise that is safe for the child to practice, that will help them, that will help stopping the habit that the child has. And like I said, it is common for children. Usually is when they are over 4, that you become concerned that you want to get them to stop it. This one is the case of a 2-year-old. So it's common for children to have a kind of habit, but by the time they are 4 or 5, you want them to stop, because then it starts having effect on their occlusion. So I don't know if that satisfies or helps Dr. Joe.
Yes, thank you.
The next question is,
what are your suggestions for nighttime?
The next question is on bruxism. Well, what we do is we have something called a bite guard, something that we put in the mouth. Bruxism generally just, it wears the teeth down over time. Bruxism is when people are grinding their teeth. They grind their teeth, and for people who brux during the eat, some people do it as a result of stress. So you want to be sure that they're not undergoing any kind of stress and all of that is triggering that bruxism. But what we do for them is they have these mouth guards that people can put in their mouth when they are sleeping. So they bite on that instead of biting on their teeth. They bite on that, and they can change it over time. These ones can be bought over the counter, or the dentist can fabricate one for the person. But it is also important to know what is causing the bruxism, if it can be managed so that the bruxism is dealt with in a holistic way.
There's a question about how often should one do scaling and polishing?
What is my take on? Well, typically we say twice a year. That's what practically every dentist will tell you. But some people need to do it more often. People who smoke, people who take a lot of coffee, a lot of tea, who take a lot of things that stain the teeth, they may need to do it more often. People who have very good oral hygiene, can get away with doing it once a year. But you need to bear in mind that scaling and polishing, apart from the fact that they're cleaning their teeth, they're also looking at all the teeth. So they're actually achieving 2 things at the same time. They're getting your teeth clean, they're getting everything looked at, so that if there are any issues, they are caught on time and they can be managed on time. Chewing sticks. Yeah, chewing sticks, any benefits? Of course, there are benefits if you can chew it properly. It is not the chewing. it is not the chewing that gives the benefits. It is the cleaning. You know that chewing stick, you have to chew it to a pulp that you can now use to clean the teeth. You know, so it is not the chewing that does the cleaning. It is the, you know, when you chew it to a pulp, you now clean. The only thing about chewing stick is that it doesn't contain fluoride, and it also does not freshen your breath. You know, two things that toothpaste can do for you. Toothpaste contains fluoride, which over time protects your teeth and makes it more resistant to tooth decay. And then a lot of toothpaste to help you have a fresh breath. You know, so when you're talking to people, they're not shifting away. But does chewing stick help to clean the teeth? Definitely, it does. It does. Yeah.
I think there's one or two more questions. What do you say about blood coming out during brushing? Blood coming out of the teeth during brushing.
Blood coming out during brushing. The commonest cause is the fact that you have what we call gingivitis. Your gums are inflamed. That is an indication for scaling and polishing. Another cause is if you are brushing too vigorously, or if you are using something like a hard toothbrush. You know, hard toothbrush is totally contraindicated. You know, what now instead the teaching is that you should use soft toothbrush. But a lot of people feel like, oh, it doesn't do a good enough job. So yes, you can use medium bristles toothbrush. You have to see it written on the pack that it is medium bristles. You know, if you use hard, you can injure yourself. You can wear away the teeth. So medium bristles, and then you brush for not more than 3 minutes. Some people spend a lot of time brushing. No matter the amount of time you spend brushing, 5 to 10 minutes after, you're going to have some coating on the tooth. You know, so brushing once doesn't stop your need to brush again another time. But the commonest cause of bleeding is that you have your gums are irritated because there's prolonged accumulation of plaque, and it is an indication for scaling and polishing.
Okay, I think that's all the question for now. Thank you very, very much, Dr. Nwachukwu. It's been awesome having you. And I think you've shed a lot of light on a lot of things tonight. So God bless you.
Thank you so much. It's been a pleasure.
We really appreciate your coming for the program today. God bless you. I think there are some parents that
Thank you so much. Thank you so much.
In the bid for some parents too, I don't know, maybe it's some, they call it, maybe it's some form of peer pressure. But this thing about, they brought party pack, it was full of sweets. Our child is also going to take party pack when we are going for birthday. And then the child kind of has sweets every day. I know a particular parent that told me that she has told her children that they should not eat the sweets in school, they should bring it home. And when they bring it home, they should hand it over to her. And that when they are asleep, she just carries them and beats all of them. That she cannot come and be lamenting because of their teeth in the future. But I know it's very, very common. I think it will be a great idea for parents to have healthier alternatives than some of these party packs that are quite common and can damage the teeth over the long term. But of course, if a child already has the habit of brushing, like Dr. Nwachukwu has advised, that may help. What will you say?
Well, like I said, I try to keep it practical. You know, you cannot eliminate candies and sweets from children. One of the things you can do is to introduce a safe practice, which is brushing at night. So after they've taken off the candies and whatever during the day, then they should brush before they sleep. And after brushing, then nothing else goes into the mouth. Some people after brushing, they still go and take chocolate, they still go and take candies and all of that. And then because of the way children are, if you keep telling them this thing, it actually sinks in over time, you know, so they'll consciously change it. Then because we are the parents that actually design these party packs, you know, we can start changing the contents of the party packs. You know, everybody on this platform is a parent or hoping to be a parent or planning to be a parent. So we can start designing healthier party packs, you know, or instead of loading the party pack with so many candies, you can just put one or two. If they are sugar-free alternatives, you can put them there, you know. Yeah, so it's something that it has to change over time. It has to change holistically, you know. But that which is under our control is to help the child develop a safe practice, which is brushing at night.
Thank you so much. Thank you so much. God bless.
That's my take.
Thank you.
Yeah, my pleasure. My pleasure. All right, thank you guys for having me. I'm so happy to have been a part of this. Hopefully I will join as a listener in future sessions.
That would be awesome.
Thank you so much, Doc.